Anxiety disorders are among the most common mental health issues globally, affecting millions of people across all age groups. Unlike everyday stress or worry, anxiety disorders are chronic, often severe, and can disrupt daily life, relationships, and work performance. Understanding anxiety disorders, their underlying causes, symptoms, and effective treatments is essential for providing support and improving quality of life for those affected. This article aims to offer a deep, science-backed overview of anxiety disorders. The different types of anxiety disorders. Anxiety disorders encompass a group of distinct conditions, each with unique characteristics. Generalized anxiety disorder, GAD. Individuals with GAD experience persistent worry across various areas of life, such as work, family, and daily activities. This worry is often vague, hard to control, and can last for months or even years. Panic disorder, characterized by sudden, intense panic attacks that come on without warning. These attacks can involve physical symptoms like chest pain, shortness of breath, sweating, and an overwhelming sense of dread. Social anxiety disorder, also known as social phobia. This condition involves extreme anxiety in social or public situations. Those affected often fear being judged, embarrassed, or scrutinized by others. Specific phobias involves intense, irrational fear of a specific object or situation, such as heights, blood, or enclosed spaces. Those with specific phobias may go to great lengths to avoid the feared object or situation, impacting daily life. Each type of disorder may disrupt daily functioning in unique ways, but they all share core symptoms of intense, often irrational worry and fear. Symptoms of anxiety disorders. Symptoms of anxiety disorders vary depending on the specific type, but often include both psychological and physical signs. Persistent worry or fear. Anxiety often involves an uncontrollable, irrational sense of fear, even in non-threatening situations. Physical symptoms. Those with anxiety may experience a rapid heartbeat, sweating, trembling, muscle tension, shortness of breath, and dizziness, especially during panic attacks. Restlessness or feeling on edge. These sensations make relaxation and sleep challenging, leading to chronic fatigue and difficulty concentrating. Avoidance behavior. People may avoid situations or places that trigger anxiety, limiting their daily life. Each anxiety disorder has distinctive symptoms, such as panic attacks in panic disorder or intense fear of social situations in social anxiety disorder. Causes of anxiety disorders. Anxiety disorders are typically caused by a combination of genetic, biological, and environmental factors. Genetic studies suggest a hereditary component to anxiety disorders. A family history of anxiety disorders increases one's risk of developing similar conditions. Brain chemistry. Imbalances in neurotransmitters such as serotonin, norepinephrine, and GABA are linked to symptoms of anxiety. Environmental factors. Traumatic events, high stress, or significant life changes like loss or illness can trigger or exacerbate anxiety symptoms. Personality traits. Certain personality types, especially those prone to negative thinking or stress, may be more vulnerable to anxiety disorders. This complex interplay of factors can increase the likelihood of developing an anxiety disorder, although many people with these risk factors do not necessarily experience anxiety. Diagnosing anxiety disorders. Psychological assessment. Professionals use tools such as questionnaires and interviews to evaluate symptoms, including scales like the Hamilton Anxiety Rating Scale, HAM-A, or the Generalized Anxiety Disorder Scale, AD-7. Physical exam. Since some medical conditions can mimic anxiety symptoms, a physical exam helps rule out other potential causes. DSM-5 criteria. The DSM-5, Diagnostic and Statistical Manual of Mental Disorders, provides diagnostic criteria for each type of anxiety disorder, which assists professionals in accurately identifying and categorizing symptoms. Treatment options for anxiety disorders. Treatment for anxiety disorders often involves a combination of therapy, medication, and lifestyle changes. Cognitive behavioral therapy, CBT, is one of the most effective treatments for anxiety. It helps individuals recognize and challenge irrational thoughts and provides coping strategies to manage symptoms. Exposure therapy, especially useful for phobias and social anxiety. Exposure therapy gradually introduces individuals to feared situations or objects in a controlled environment to reduce anxiety over time. Medication. Selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines are commonly prescribed. SSRIs help balance brain chemistry, while benzodiazepines provide short-term relief but are not typically used long-term due to dependency risks. Lifestyle changes, regular exercise, healthy eating, sleep hygiene, and mindfulness practices such as meditation can significantly alleviate anxiety symptoms. Social support. Support from family, friends, and support groups offers comfort, motivation, and understanding, which are vital for individuals coping with anxiety. The role of society and culture in anxiety disorders. Understanding and addressing anxiety disorders also requires awareness of social and cultural factors. Stigma reduction, education, and encouraging mental health support can positively impact those living with anxiety disorders. Cultural attitudes toward mental health can shape how individuals perceive and seek treatment for anxiety, making awareness and acceptance crucial for creating supportive environments. Coping strategies for anxiety in daily life. Alongside professional treatment, several self-help strategies can assist individuals in managing anxiety. Mindfulness practice. Techniques like meditation and deep breathing exercises can calm the mind and reduce anxious thoughts. Routine establishment. Following a structured daily routine provides stability and a sense of control. Limit stimulants and alcohol. These substances can intensify anxiety symptoms. Anxiety disorders profoundly impact the lives of those affected, but with the right treatment and support, individuals can lead positive, fulfilling lives. Social understanding and empathy play an essential role in supporting individuals with anxiety disorders and fostering a mental health-friendly community.